Serious, doctors of Reddit. What do you think of your country's healthcare? What would you change if you could? US doctor. The care is for the most part good. I think many, not all, problems could be fixed by switching to huge deductible plans for insurance. Even better would be to make healthcare as a real free market. So much of the price and shitty access to care is a result of the bureaucratic and over-regulated industry. I cannot tell you the amount of money I waste on orders that I don't need and time writing things that I don't really have to just so I can avoid being sued. There is no one fix. But there are many common sense solutions. Since this will inevitably come up, I do not think single payer is a good option for the US. The closest thing we have to it is the VA, which, the two I've worked at, absolutely terrify me. American physician here. I work in a busy ER in New York City. I have a lot of patients that don't have insurance. When they ask me, how much does test X cost? How much does pill Y cost? I cannot give them a number. Hospitals do not give providers access to the actual costs of things. It's infuriating to have to always say, I'm sorry, I don't know. And I can't find that out for you. Double quote. General surgeon here. An MBA friend of mine put the whole problem of the healthcare system in the USA into one sentence: we have tried the healthcare system in the US. Based on a capitalistic model for 100 years and it doesn't work. It's time to try something else. A single payer system seems to be the model other countries have the most success with. It's not perfect, but everyone is insured and are not devastated financially by an accident or illness. There is great resistance to change the system we have, even if it sucks. Because people resist change and there are a lot of people making a lot of money with the present system. That is all. I am not a doctor, but I am an office manager of a physical therapy clinic in the United States. I do all of the insurance billing, checking benefits, and all other interactions with insurance companies, which is a constant headache because of how many insurance companies there are and how much variation there is between them. Medicare is the worst to deal with though. Their online portal for providers almost never works. They have billing requirements specific to them which takes extra work and time. Another thing that really pisses me off is how expensive treatment is for some patients. Some insurance plans have deductibles of $2K or higher. I always feel horrible when collecting large amounts of money from patients when it should, in my opinion, be coming from the insurance that they already pay for. In a perfect world, there would be one insurance company for everyone with no deductible, copay, or co-insurance that has a solid provider portal and is easy to deal with. No one should have to pay as much for healthcare as Americans do today. It's just messed up. Pakistan. Final year mid student here. It's kinda really fricked up here. We don't have a proper policy here. What we have is a hybrid of free healthcare for everyone policy. But with our economy it doesn't work. Government hospitals are below standard and anybody who lives above the poverty never prefers to visit a govt hospital. Even the poor ones are forced to pay for their drugs, free drugs in ER only. Senior doctors are absent from the hospitals most of the time, focusing on their private setup and clinics which pays them handsomely. It's below AVG type of system, but it has an immense potential and I'd rather want to implement a policy by feeding in more budget. By keeping good check and balance, I am sure this can become one of the great system for our country in current situation. I'm no doctor or anything. Just a random citizen from Australia. It angers me that every country, mine included, can only focus on pushing towards privatization of healthcare. Of course, public healthcare for a country of a large population will be costly. But I'd much prefer increases taxes than have to see old citizens who can't no longer work fork out F tons on insurance premiums. As evident from reading countless of comments on the US healthcare. Private health insurance simply breeds greed from hospitals. Because they can. Charging crazy amounts for mundane procedures towards the patient just because insurance companies will negotiate but still pay a crazy amount. Sending insurance premiums up each year. Sure, with advancement and modernization, The population in many developed countries is aging and people living longer, causing significant costs to the public medical system. But honestly, what on earth is more important than caring for humans' health? It annoys me that globally governments seem to want to palm off healthcare to the private industry more and more. Okay, I'm veterinarian and it's the end of the quarter and I spent a chunk of my morning looking at spreadsheets and lists of people who failed to pay me and my doctors. About 85% of the folks who needed some financial break in the last 90 days failed to pay their bills, despite payment arrangements, health checks, whatever else. They just don't bother paying us for, in large part, critical medical procedures on their animals. When I say critical, I mean if we don't do this, the pet dies critical. Heaven forbid you don't pay a mechanic or a lawyer or a plumber. But nobody seems to have a goddamn issue stiffing their veterinarian. What would I change? I would have people pay their damn bills. There are far more serious subjects to be addressed in the medical system. But hey, I saw an opportunity to rant and went with it. Speaking for my dad, who is a recently retired anesthesiologist. He has worked in Poland, Spain, Australia, Guam and Saudi Arabia. He says that Canada has some of the world's best doctors, however the system is broken and varies widely between provinces. If you are from Quebec, you've probably had bad experiences, but if you're lucky enough to live in a small town with a large hospital, Cornwall, Ontario for example, you can have great service. In his opinion, we should go to a private public system where doctors are forced to work for the public system for a period of time before being allowed to move on to private work. Not a medical doctor, but I'm a department. I had to leave the clinic I worked at because they would make me turn away patients that were not ready to continue on a home exercise program. If their insurance company didn't authorize any more visits, I had to tell them they were out of luck. Now I have my own clinic and will treat a patient for an extra few weeks free of charge if I feel as though they would really benefit from it. There was a pretty interesting talk on TED, which I can't seem to find. Basically it describes the overwhelming negative stigma present in the medical field where admitting one's mistake, which would otherwise lead to saving lives, is seen as a weakness and is a shameful act, even though it is a mistake. Where doctors can't really talk about what they did wrong because of how it would be perceived, because it is a person's life after all, and how this system of guilt needs to be eradicated. American anesthesiologist. For me, it's working in a for-profit hospital that wants to hire an AMC, anesthesia management company. Basically, a business group underbids a group for their contract. They then go out and get rookie docs or foreign grads or flat out crappy docs along with nurse anesthetists to staff their new hospital contract. They lowball everyone. If they know you have a family. This is the only hospital around and are banking that you won't move. They work the F out of you, while taking the lion's share. They make more money because these big groups get even bigger, gaining market share, and so can get bigger payments negotiated with insurance companies. Many doc-owned groups require a subsidy, which now the AMCs will undercut. Now there are so many AMCs, you couldn't join or form your own group unless you got lucky. They run everything as lean as they possibly can, to the point it's goddamn unsafe. Yet they have just enough of us good docs to put out the fires and keep the place moving. As for what I would want as normal citizen, I say publish hospitals' charge master forms. Right there. You'll see where all the money in our healthcare goes. And it ain't to the docs and nurses. Let me tell you. Allied health technologist here in the US. And the one thing that astounds me is the top-heavy bureaucratic system we have in this country as a whole, as well as on the local level. In our hospitals of 200 plus beds, there are so many jobs that exist not to give care but to manage, and some would say overmanage. A strange fact about the profit-driven healthcare system here is there are vast legions of people who do not generate a dime of revenue nor come within a mile of a patient. I'm talking about the ivory tower MBA set, not the janitors. Departments are squeezed to save a nickel so that administrators can blow $50 somewhere else. I have to wonder, how much leadership does the American healthcare system need and how much can we afford? I was always taught that doctors ran healthcare. But at least in the top heavy U.S. system, MBAs run the show. For Morocco, it must be improved. And many things should be changed in order to be free for all citizens. For services are not in the top. Because there is no control. Also there is less responsibility regarding the person who working in this domain. Unfortunately. Nurse here. Sorry if I don't fit. One of the largest problems I see is interference of parents during care for pediatrics. Social workers have been called multiple times on many cases I've dealt with. But rarely does it make a difference. My biggest change would be adding a better means of removal change of primary caregivers. American physician assistant here. I think the quality of care is generally good in our country. I wish I could articulate some suggestions for improvement, but the system of insurance providers, payments, adjustments and so on is so complex and convoluted I don't know where to start. I can tell you that I intended to practice medicine, but daily I spend more and more time arguing with insurance companies trying to deny my patients drugs or procedures they need. I also see my cohorts being driven to spend more and more time thinking about government penalties for readmissions following surgery, length of hospital stay, etc., rather than worrying about patient care, which is the whole goddamn reason we do this in the first place. That does make me fighting mad. ABF, it is frustrating having nothing to compare our system to. I don't know what could be improved. I do believe we have some of the best and brightest providers in the world and access to some of the best technology, and have total confidence that I am offering the best treatment I can to my patients. My complaints working in the Canadian system as an RN are that I feel like we don't have enough low-level staff, i.e., and maybe this is regional because I haven't been to other parts of the country, but we have no nurses, aides or orderlies to help with the cleaning, moving, toileting of patients, which means on an oncology floor where intensive monitoring and care is to be expected, the nurses basically have to do everything from toilets to monitor to medicate. Secondly, I don't feel like we innovate. I live really close to the US and the medical innovations pour out of their top tier hospitals like you wouldn't believe. I can't say the same here. Further, it's expensive. Really expensive. Canada spends an arseload of money, second only to the States, and we do not get good outcomes. Nothing nearly as good as, say, the NHS. Also, it becomes a crutch for sponsoring stupid legislation. It is now a fineable offense in Ontario to smoke on the outdoor patios at a bar, and much of this is reasoned out with second-hand smoke and the cost to the system. Also, we seem to refuse to take good cues from our American neighbors because we're so afraid of privatization. Care flows and things are really freaking good ideas, but we don't seem to use them here. I've been to the hospital here in Norway just once, visiting a friend. And I could write a 10k word essay about it. But I'll sum it up for you. Nice and short. Pro. It's free. Full of gorgeous blondes and brunettes. Con. I want to work there. But I don't work there. I want to change our corrupt licensing requirements that ensure our salary is double what it is in other countries and that our patients receive worse and more expensive care. I also want to change the fact that my idiot sons could still become doctors if I pay for them to get their degrees in the Caribbean, and for them to volunteer at Beth Israel for several years even if they don't match. Not a doctor here, but I work in a hospital in London, UK. Our medical staff are phenomenal for the most part. And the NHS is one of the greatest organizations I have come across. However, we are very quickly having resources taken from us. They shut A&Es. Despite the waiting times growing every month. They give us less trainees each year. Despite the fact they are vital in maintaining service. They have also recently banned the use of locums. Due to the price of hiring them. It feels like the government is slowly making it impossible to continue running this hospital. So that we will have to declare ourselves unsafe. This way they can close us down without taking the flak. I might add that people in the UK are very quick to blame immigrants for draining our national services. Which is a common misconception. If I could change anything, it would be to make the management of the NHS more transparent. so that people could see who is really doing the damage to it. Close bracket. The Danish healthcare system takes a lot of for long waiting lists. But the truth is, it is pretty awesome that you can go talk to your doc off the street and not pay anything for a checkup. United States. All I really want to be changed is that all the states somehow get it expanded so that everyone who is under a certain income receives insurance instead of being trapped under a mountain of debt. Sorry, but you are mistaken. Perhaps you were thinking a competitive capitalistic model. Not a lot of competition in healthcare, you are correct there. But if capitalism is receiving money for goods and or services provided, I can assure you it is alive and well in our healthcare system. Aussie here. I would treat all graduating doctors as conscripts. They would have no choice of what they would specialize in. If we need GPs, then they all will be GPS etc. Get rid of the bullshit docs like plastic surgeons etc.